Let's continue our journey through the lymphoid neoplasms, cancers derived from the B and T cell lineage. In our last sketch, we met the leukemias, and now we're moving on to the lymphomas. And you might say to yourself, emias, lymphomas, say what? Well, let me explain. If the neoplastic cells take over the bone marrow, subsequently causing cells to leak out into the bloodstream, that's a leukemia. We saw this in the last sketch, with acute B and T cell lymphoblastic leukemia, chronic lymphoblastic leukemia, and hairy cell leukemia. It's all about getting into that bone marrow. It's just what they crave. Lymphomas, on the other hand, such as Hodgkin and non-Hodgkin, originate in the lymphatic system, including the lymph nodes and spleen, where they form tumors. That's the oma in lymphoma. No marrow necessary. Alas, nothing in life is that simple. And leukemias can involve lymph nodes and look like lymphoma, while lymphomas can take over the bone marrow and present like leukemias. So the best you can do is take a look under the microscope. Analyzing the morphological or molecular characteristics of the cancer cell in question is key to understanding what kind of lymphoid cell you're dealing with, and from whence it came. And on that note, welcome to Hogwarts School of Wizardcraft and Witchery. This hidden Scottish castle houses one of the world's oldest schools for magic. Every year, hundreds of aspiring young wizards and witches arrive by train, eager to learn from the finest faculty in the world. Students have an opportunity to master everything from potions to spells, while bonding with friends over a game of chess or a trip to the owlery to write home. You know what else takes place in the owlery? Secret magic. Yep, we're going to be practicing our spells up here, accidentally mutating a few B cells while we're at it. Hodgkin lymphoma, first described by Dr. Thomas Hodgkin in 1832, is a neoplasm of B cells. So to start off this sketch, let's draw in our usual B cell archers, complete with antibody arrows. Now, in acute lymphoid leukemia, B cell precursors in the bone marrow get mutated, causing immature lymphoblasts to fill the marrow and blood. And in chronic lymphoid leukemia, a B cell a little later in the lineage decides to mutate and send a bunch of mature B cells into the marrow and blood. In the lymphomas, such as Hodgkin and non-Hodgkin, the B cell makes it out of the marrow mutation-free. Woohoo! It then floats around in the blood for a while. Then it hits the lymphatic system, and then it gets sidetracked in a lymph node. The hottest place in a lymph node? The germinal center, of course. It's like a warehouse party full of B cells, just getting lit and rubbing up against each other, interacting with helper T cells, proliferating, differentiating, and most importantly, mutating, so that they can make more selective antibodies. This is called somatic hypermutation, and if you were to analyze a Hodgkin lymphoma B cell, you'd see that it's already gone through this step. B cells also undergo antibody class switching at the germinal center, which lets them shift from IgM production to something more fun, like IgG production. Anyways, since we're in the owlery, a germinal center will be represented by an owl nest. Think of it as a place where owls proliferate. As you can imagine, when all that DNA is switching around and mutating at the germinal center, accidents can happen. Hodgkin lymphomas stem from a single mutated B cell in the germinal center or right after it leaves the germinal center, stuck somewhere in the stages of normal differentiation. This mutant cell proliferates and fills the node with a monoclonal collection of abnormal cells. That's right, just a bunch of clones, kind of like this cute set of octuplet owls. Aw. This is actually one of the important ways you can differentiate a normal hyperproliferation of B cells, which can occur, say, during an infection, from an abnormal proliferation of neoplastic B cells. During an infection, the lymph node creates all kinds of different B cells. When a lymph node is taken over by Hodgkin lymphoma cells, however, their genes and protein products are identical. They're clones. Cute little clone mutants, with their piercing, unblinking stare. Okay, that's creeping me out. Now, I've been focusing on lymph nodes this whole time, and it's the classic spot for Hodgkin lymphoma to start. But other sites of lymphoid tissues contain germinal centers as well, like the liver and spleen. Hodgkin lymphoma can arise at any one of these sites. Most commonly, it's a lymph node, however, and disease usually spreads in a contiguous stepwise fashion, moving from the original lymph node to adjacent nodes within the same local group. Hodgkin lymphoma most commonly occurs within the cervical, supraclavicular or mediastinal lymph nodes. That's the neck and chest. Here's the thing. If you're going to call it Hodgkin lymphoma, you've gotta see Reed-Sternberg cells on histology. Seriously, no Reed-Sternberg, no deal. So at the center of the room, I'd like to introduce you to Hodgwig. A Reed-Sternberg cell contains that iconic pair of mirror image nuclei or nuclear lobes, which give the impression of an eerie set of owl's eyes. Each pupil represents a dark acidophilic nucleolus surrounded by a distinct clear zone. The oval around each eye represents the prominent nuclear membrane that can be seen surrounding each lobe. On histological section, you'll notice that Reed-Sternberg cells are actually pretty sparse, while the background is filled with inflammatory cells. Lymphocytes, eosinophils, neutrophils, fibroblasts, all kinds of stuff. This inflammatory milieu is depicted by the accumulation of bluish owl poops on the floor of the owlery. Kinda looks like all those extra blue nuclei that you'll see in the background. These reactive cells are known to release factors that aid in tumor growth and survival. So, they're not just idly standing around back there. In addition to visualization of these pathognomonic Reed-Sternberg cells on histology, flow cytometry can also help out. Hodgkin lymphoma cells can be identified by their specific immunophenotype. Turns out they like to express CD15 and CD30, and not really any other of your classic B-cell markers. Notice the subtle 15 and 30 Roman numeral designs we've incorporated into Hodgwig's feathers. Recently, research has shown that a significant fraction of Reed-Sternberg cells have genetic alterations caused by infection with Epstein-Barr virus, or EBV. And what's the best way to practice some unsanctioned magic spells? With your best pal and a pint of butter brew, of course. On tap at Epstein's Bar. Now, not all Hodgkin lymphomas have evidence of EBV infection. So, viral infection is probably only a part of a complicated multi-step progression toward malignancy. A subset of EBV genes codes for factors that activate B cells through pathways such as NF-kappa B and MAP kinase. NF-kappa B is symbolized by that NF-kappa charms book. And we've emphasized this pathway specifically because constitutive activation of NF-kappa B is one of the possible methods that mutant B cells evade apoptosis. Think of it as a Reed-Sternberg invincibility spell. Both a personal and family history of autoimmune disorders such as rheumatoid arthritis, systemic lupus erythematosus, and sarcoidosis have been shown to increase the risk of developing Hodgkin lymphoma, though the reasons why are unclear. All right, let's get clinical. See the shape the rug is forming? Collectively, the various forms of Hodgkin lymphoma have a bimodal age distribution, with a peak around 20 years old and a second peak around age 65. While the presentation of Hodgkin lymphoma is highly variable, it generally involves a painless mass. So remember to check out those lymph nodes. The cervical and supraclavicular lymph nodes are often involved, and will probably feel kind of hard and rubbery if there's a lymphoma lurking in there. Hodgkin lymphoma also commonly presents as a mediastinal mass, usually spotted on a routine chest X-ray. Constitutional symptoms, also called B symptoms, are commonly seen as well. These symptoms arise due to all the cytokines being secreted by the neoplastic cells, further stimulating the surrounding inflammatory cells to do the same. These symptoms are especially prominent in advanced disease and are a clear indicator of worse prognosis. B symptoms include fever, unintentional weight loss, and sheet-drenching night sweats. Just a few unintended side effects from that stray spell beam. Well, that's about it for the general characteristics of Hodgkin lymphoma. Let's now dive into the different subtypes, spending a bit of time on the features that make each subtype unique. We'll begin with the most common subtype of Hodgkin lymphoma, nodular sclerosis, which comprises about 75% of cases. This subtype will be illustrated under that nodular and knotted tree limb, decorated with the banner for House Sclerosin, the winner of this year's school-wide Ditch tournament. Okay, this whole Hodgkin pun is kind of wearing a bit thin. Oh, hey, here's an interesting fact. This subtype is the most common in developed countries, and multiple studies have shown an association with higher socioeconomic status in childhood. Weird, right? Now, this was only in a case report, mind you, but Hodgkin lymphoma has been shown to be directly correlated to the number of dives into a swimming pool full of gold coins. But, correlation doesn't prove causation, so take it with a grain of salt. Microscopically, the nodular sclerosis subtype shows distinct nodules of inflammatory cells separated by fibrous collagen bands. Kind of like the nest of cells up there, with that fibrous tree bark in between. Reed-Sternberg cells are rare, but present. So don't forget about Hodgwig over there in the middle of the room. What makes nodular sclerosis really unique, though, is a specific neoplastic cell type called the lacunar Reed-Sternberg cell. This special type of Reed-Sternberg cells have many of the same features of regular Reed-Sternbergs. Giant cells with a multi-lobe nucleus that resemble owl eyes, and what have you. However, lacunar Reed-Sternberg cells also have characteristic clear areas where cytoplasm has been displaced during the slide fixation process. These empty spaces are called lacunae, meaning gap, and look exactly like that. A ring of clear space surrounding the cells. After nodular sclerosis, mixed cellularity Hodgkin lymphoma is the second most common subtype, making up about 20% of cases. For those of you keeping score at home, we are already at 95% of all Hodgkin lymphomas, and we've still got 3 subtypes to go. Mixed cellularity, by the way, is embodied by Hodgmine here, mixing and matching potions. Unlike nodular sclerosis, mixed cellularity Hodgkin lymphoma is more common in developing countries. Hence the globe design etched into the cauldron. This subtype is also strongly associated with EBV infection, especially in those co-infected with HIV. A unique feature of the mixed cellularity Hodgkin lymphoma is that it predominates in the abdominal lymph nodes and the lymphoid tissue of the spleen. On histology, nodules are seen. However, unlike nodular sclerosis Hodgkin lymphoma, there's a lack of fibrous septae separating the nodules, so they're just free to boil over. Reed-Sternberg cells are numerous and surrounded by the usual background of mixed eosinophils, histiocytes, and neutrophils. Just cells everywhere. All right, the last subtype to know is called the lymphocyte-predominant Hodgkin lymphoma, also known as the non-classic form. It's embodied by Hodgrid in the back there, who's kind of a non-classic member of the school himself, since he's a giant, not a wizard. What makes the subtype non-classic is the fact that it contains almost no Reed-Sternberg cells. So instead of an owl, he's brought along his trusty griffin companion. Remember that 15 and 30 we incorporated into the Reed-Sternberg owl's feathers? Well, again, griffin, not owl. So expect the lymphocyte-predominant type of Hodgkin lymphoma to test negative for CD15 or CD30, common markers of classic Hodgkin lymphoma. The lymphocyte-predominant subtype has its own special variant of the Reed-Sternberg cell, actually, called the lymphohistiocytic cell. These cells have a delicate, multi-lobed, puffy nucleus that looks like an exploded popcorn kernel. Instead of CD15 and CD30, these lymphohistiocytic popcorn cells express CD19 and CD20. See what we did with the stitching there? Clinically, this Hodgkin subtype is a more indolent disease, in contrast to the classic Hodgkin lymphomas. B symptoms are rare, and the prognosis is generally good if it's discovered in early stages. This rare condition, 1 in a million incidents in fact, has a strong male predominance and, unlike classic Hodgkin lymphoma, is more common in African Americans. 2 more subtypes of classic Hodgkin lymphoma deserve a brief mention for completeness: lymphocyte-rich and lymphocyte-depleted. However, since they're so incredibly uncommon, together they only make up 5% of classic Hodgkin lymphoma. Just going to... Oh, dang. Would you look at the time? Time to wrap up this sketch. All right, the big things to remember about Hodgkin lymphoma in 13 phrases: germinal B-cell mutation, monoclonal owls, Reed-Sternberg cells, CD15 and CD30, inflammatory infiltrate, that one guy in the back there, EBV the culprit, bimodal age distribution, incendio, cervical or mediastinal mass, traveling from node to node. Lots of subtypes.